Cryoablation, the prep work was, I I had to, there were procedures, I had to take like an enema, it was called like Go Lightly and stuff. And then they prepped me pre-op. I went in, talked to the nurses and stuff. And to be honest with you, after that, I had to ask the doctor what happened because they put me out. Now, from my understanding, is that they said they rolled me over and they went in through my anus. I think they used a robot, and they did what they had to do. And they also told me that I would not be able to produce children again because of freezing of the tube which goes through the prostate. It was that it, but that's not a problem. I was thinking about living with my DNA attached to a donor's egg. Science is so far, you would not believe it. But I mean, it's like stuff they have for people like me. So you don't have to be afraid of it. Embrace it. After the procedure, they gave me ice, I guess because I couldn't have liquids immediately after surgery. I went home that night. I had something small to eat. I cooled out the next day. And the Monday, which is the third day, I was back. I was back at work. You know what I mean? I could still ride the bike. The bike is fast. Nothing diminished. But again, I didn't have any scarring or anything. But just the idea that, it was sort of uncomfortable, like wearing a bag around and stuff like that there. But I just switched sides and kept on trucking, But man, if you got this stuff, man, don't wait around because it moves. You don't want this stuff to get in your bones or your blood. You kiss the baby. I mean, you kiss the baby, it will take you out of here. Okay?
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.